I'm going to start, okay? Hi, everybody. Welcome to Live with Dr. Malik. Today, we have a very special live for you guys. We are going live, sponsored by Elora, a cranberry supplement that's used for urinary tract infections. If you missed my last video about cranberries for UTIs, make sure you check it out. I released it this Monday, or this last Monday, and it tells you all about why cranberries can help you prevent UTIs, what specific things you need to look for in a cranberry supplement when you're buying one, to actually find one that works, because a lot of them just don't work. And so you have to really be careful that you're spending money on something that's actually going to help you. But thanks guys so much for joining me this morning. I always appreciate you all so much. I hope you're having a wonderful weekend, and please feel free to put your questions and comments in the live. I will be only focusing on questions about female pelvic health and urinary tract infections today, to kind of focus the lives. And probably moving forward, I'll also do this for my lives so that we can kind of cover a variety of topics during lives. But my first question I'm seeing here is urinary tract infections, or are they a sexually transmitted disease? Well, that's a great question, because I hear it all the time. People say, did I get a UTI from my partner, or did they give it to me? And so that's not exactly true. When you have a UTI, and you have sex, yes, it can put you at a risk for getting UTIs because of the actual action of the penetration, but it's not that you're getting it from your partner. Your partner, if they do get a UTI, cannot give it to you, and vice versa. You cannot give it to them. It's actually based on your own biology and the bacteria that enter your urethra, and women mostly from the vagina or other places like that, where you're getting your infection from. So it's not a sexually transmitted infection. Okay. Next question. Is it true that you get more UTIs as you reach menopause? Why is that? And is there anything I can do to stop it? That is an excellent question, because I will tell you the large majority of women that come into my clinic are, around menopause, and or post-menopause, and like, I was fine my whole life. And all of a sudden I start getting these horrible, pesky UTIs. And so, yes, actually you can get more UTIs after menopause. The reason being because the actual pH, or the acid base of your vagina, changes. And so usually throughout your life, when you have a normal amount of estrogen that's reaching the vagina, your pH is acidic. And that allows a prevention of E. coli, bacteria called E. coli, to grow. But as you get through menopause, you lose estrogen, and that pH becomes more basic, which makes it actually harder for prevention of E. coli. And so more E. coli can grow, and you can get more likely to have urinary tract infections. And so, yes, you can absolutely prevent it by getting estrogen vaginal cream. And that's an ointment, that's a cream or a tablet or a ring, and vaginally, not the pill form, but vaginally, and taking that. Usually what it is once a day for 2 weeks, and then twice a week for the rest of your life, can help prevent urinary tract infections. It also has some really great other benefits, in the sense that it can help with vaginal dryness. And for some people, they can notice some benefit with urinary symptoms if they're having them. And so it's very, very safe. In fact, it's been never reported to have any risk for breast cancer or blood clots. And so it's extremely safe. Even if you've recovered from something like breast cancer, nowadays we are safely giving it to people, because the amount of the estrogen that gets into your full body is extremely low. It's all really localized to the vagina. Next question is, how much of a risk factor is an uncircumcised partner for UTIs? So being uncircumcised as a man actually puts men at risk for UTIs. The reason being is that sometimes when you urinate, if urine gets trapped behind the foreskin, then it can more likely create bacteria and travel back into the bladder. So it's not that your partner is going to get it, but you yourself may be at a higher risk. So when we see little boys getting UTIs, the first question pediatric urologists will ask is, are you circumcised? The reason, or is your son circumcised? And the reason being is because that is what causes it. So one of the treatments that we sometimes suggest for a boy who's getting recurrent infections is to get a circumcision, particularly if we don't find any other cause for the UTIs. Okay, is there a link between diabetes and chronic vaginal irritation? Well, diabetes and vaginal irritation, I don't want to give you the wrong answer. So I'm not exactly sure if it causes vaginal irritation specifically, but I know that in the bladder itself, having diabetes can affect your bladder symptoms. And so first, when you get diabetes, you get what's called overactive symptoms. So symptoms like urgency, frequency, meaning you got to go, and you can't wait. You can't hold off that urge. You got to rush to the bathroom, and sometimes even accidents. And that's because your bladder becomes overactive and it has these contractions that squeeze the bladder muscle before your brain tells you that it's ready. And that's because of the sugar that comes through your urine when you get diabetes. As you get diabetes for a longer period of time, your bladder actually changes and the bladder squeeze becomes weaker. So a lot of times people who've had diabetes for a long period of time, they won't be able to squeeze their bladder very, very strongly. And so they'll often find that they're not emptying their bladder well. And so there's kind of the typical presentation over the lifetime of someone who has diabetes. Certainly if you're having leakage of urine, that can create some vaginal irritation as well. So next question is, what do you recommend for bacterial prostatitis? Are there any good supplements? Do you think cranberry pills help with this? I don't want to keep taking antibiotics. That's a really great question. So bacterial prostatitis, I think the most important thing is to make sure that you're getting truly, you having really a bacterial prostatitis and not recurrent UTIs, because I think sometimes they are, they're similar. The symptoms are similar. Prostatitis most often presents with, urgency, frequency, sometimes really high fevers. And then when you go for your exam with your urologist, if you get a prostate exam, you can have a kind of tender prostate on the examination. And that's how we can tell. And you'll also see the infection in urine. If it's a infection that's coming from the bladder and not the prostate, cranberry supplements can help. I don't know about any supplements for bacterial prostatitis, but I'll try to look into it and get back to you about this. And I understand you don't want to keep taking antibiotics. So just be sure that you've been completely worked up to make sure that it's not coming from the bladder or the kidneys or some other source, like you don't have a kidney stone or something else that's causing the recurrent prostatitis. And so you can kind of reevaluate and make sure there's nothing else going on. Okay, great. Next question is, how do we prevent a toddler from getting a UTI? So I got to share this with you guys. My son had a UTI. So I actually made a video about this and I'll link it in the description below, as well as any videos that we talk about here today. But my son, who was, I think 4 at the time, got a UTI. He said, "Mommy, it's really burning when I pee." And I said, "Oh, you're probably fine. Just drink some more water." And then it got even worse, where he was like, he would pee and then he would scream in pain, and it was horrible. So the number one reason, I did talk about circumcision, but the other reason that's most common is constipation, which you're like, what? Why would constipation cause UTIs? But it does, very particularly in children. It's a very common cause. And same with adults, constipation can worsen that frequency. But so I had to have my son start taking Miralax, which is a medication that you get over the counter. It's in a big white bottle, usually with a purple top, and you pour it into your drink. And so I started having to give it to my son to make sure that, 1, he was getting soft bowel movements, and 2, to really make sure he was hydrating well. And I realized, when kids are super busy and playing, they don't really think about drinking as much as the average adult does. So making sure they drink enough and they're having soft bowel movements. And if you don't want to give something like Miralax, it's very, very safe, of course. But I get a lot of patients who, get nervous about taking things that they don't know are, are technically medications. So you can also do prunes. So I make a prune smoothie for my son with bananas, prunes, and some nut butter, and some almond milk, and he loves it. So we do that very often as well. And then you do need to see a urologist, a pediatric urologist. If you keep getting UTIs, you'll probably get a renal ultrasound and maybe something called a VCUG, where they fill the bladder with some contrast and see if it goes up into the kidneys with something that's called vesicoureteral reflux, because there can be other structural or anatomic like problems that cause UTIs. But like I said, the number one thing I would recommend is preventing constipation, making sure they're hydrated. Okay, next question is, what do you recommend for treating urinary incontinence? Well, I talk about this a lot on my channel. I will link a bunch of videos about urinary incontinence in the description, but urinary incontinence can occur for a number of different reasons. First of all, what is urinary incontinence is essentially leakage of urine or accidents that happen when you don't want them to. So when you're not trying to go to the bathroom. And so they can happen because of stress urinary incontinence, which is when you do something that increases your pressure in your belly. So if you cough, if you sneeze, if you exercise, if you run, if you walk, if you jump on a trampoline and you leak because of those things, that's called stress urinary incontinence. And that's caused because of weakness of the pelvic floor or the sphincter, which is basically like the opening for the urethra that opens when you pee. And when you have those weaknesses, those are treated with either pelvic floor physical therapy, like doing Kegel exercises. And again, I'll link a video about Kegel exercises below, or different types of procedures and surgeries. The other type of very common type of incontinence is urgency urinary incontinence, which is that gotta go, can't make it, and you leak because you have that urge and you can't make it in time. And that can be caused by a certain number of problems. So it can be caused because you have some sort of blockage, like a large prostate, or in women, if you've had a surgery that might tighten the urethra, that can cause it. It can be caused because of neurologic conditions. So very often patients who've had multiple sclerosis or Parkinson's, they can get this kind of leakage, or just from aging. And so treating that, I have a whole kind of video playlist on overactive bladder, and the treatments for overactive bladder are the same as the treatments for urgency urinary incontinence. But briefly, they're conservative management, like watching how much you drink, avoiding constipation, avoiding things that irritate your bladder, like alcohol and caffeine, like right here. I love my caffeine. And for some people, making sure quitting smoking and avoiding constipation can help. And then there are medications, and then there are procedures also that are available for urgency incontinence. And lastly, there's overflow incontinence, and that's if your bladder is not emptying completely, and you are just literally overflowing, like as if you were filling up a bowl with water and you forgot and it started overflowing. That's the same thing. And in that case, we have to treat the fact that you're not emptying your bladder, and there's a number of different causes for that as well. In the past, I have gotten UTIs when traveling. I'm going back to traveling now, and I'm terrified of getting them again. What can I do to stop them? So a lot of people get them when they're traveling because they get dehydrated. So making sure that you're keeping up with your hydration, drinking lots of fluids, can be really helpful. Also considering maybe talking to your urologist about taking a set of antibiotics with you when you travel, so you don't have to like figure out how to get antibiotics when you're abroad or somewhere else, and finding a pharmacy and all that. So very often for my patients, I'll do that. But certainly talking about other ways to help prevent UTIs with your urologist can help. The number one thing is drinking lots and lots of fluids. Also, like I said, you can manage your constipation. I've said that many times today. If you are postmenopausal and a woman, you can get vaginal estrogen cream. And I recommend for my patients to try cranberry tablets like Elora, because they have been shown, if they are 36 milligrams of proanthocyanidins and soluble, that they are as effective as taking a single dose of antibiotics every single day. And so for me, that's a no-brainer. Like, why not? And in fact, in our American Urological Association guidelines, cranberry supplements are recommended as an option for helping prevent urinary tract infections. Okay, so I have suffered a UTI disease that has tested negative, yet inside me, I feel it. Pains at the tip of my penis. Sometimes I have sensation in my testicles. I have used a lot of antibiotics, but no response. I see this all the time. And so this is a great question. And this can be this person who's having these symptoms. This can present like this in men and women. You can feel like urgency, frequency, pain. And there's a lot of different other causes that sometimes people just don't realize. And so one of these is pelvic floor dysfunction. So if the muscles in your pelvic floor are really, really tense, just like you get TMJ when your jaw is clenched really tight because of stress, the same thing can happen to your pelvic floor. And so when that happens, it can cause pain. It can cause feeling of urgency and frequency, just like you get with a UTI. You can also, in men, sometimes have the pain at the tip of the penis is actually it's very specific. And the reason being is that when you have bladder spasms, like urge, like gotta go, and you have that urge, sometimes that can refer in men to the tip of the penis. So sometimes getting medications that are typically used for overactive bladder that help prevent spasms can help with that pain. So if antibiotics are not working, you probably don't, and your UTI urine cultures come back negative, you probably don't have a UTI. It's probably something else, like it's overactive bladder, high tone pelvic floor, or something like interstitial cystitis. And I'll again link a video about interstitial cystitis in the comments below, but very briefly, it's a disease that is a disease of exclusion. And so once you've ruled everything else out, interstitial cystitis, it's like a mouthful, we say IC, is a syndrome that is made up of specifically pain that's perceived to be coming from the bladder, and it can be coming and associated with urgency or frequency of urination as well. And so there are a whole pathway of treatments for IC that are different from overactive bladder or UTIs. Next question is, I feel urgency, but my bladder is not emptied. So this is again, urgency can be a symptom of overactive bladder. And so sometimes getting medications that help with overactive bladder can help, or doing some of the conservative things I talked about. Also want to make sure that you are emptying completely. And so if you're not, we have to find out why. And so that requires a trip to the urologist so we can, one, scan your bladder, see if you are emptying with what's called a post-void residual scanner. And that can actually that'll help scan your bladder and helps tell us how much urine is in there after you pee. And then we would do further investigation to see, why are you not emptying your bladder? And then if you're not emptying, that will explain the urgency because you still have urine in there. And if you are emptying, then we talk about other causes of urgency, similar to what I talked to last time, just the last question before this, is that it can be from a number of different causes, like interstitial cystitis, overactive bladder, high tone pelvic floor. What causes a colovesical fistula and how to prevent it? So the causes of a colovesical fistula is basically a connection from the colon, where you store your poop or where you poop from, to your bladder. And that can present with symptoms like recurring bladder infections. You can have actually see little particles in your urine or bubbles in your urine. And so that's typically how it presents. And what do you do to prevent what causes it? Well, it can be because if you've had a really bad bout of diverticulitis or infection of the colon, it can be because you've had radiation to the area and the tissues are weak and they form this connection, or it can be because you've had surgery before in those areas that causes this to connect. Or it could be, there's a lot of different reasons. Another one could be that you have a cancer or something like that might be causing the tissues to connect. And so definitely need to work up if you have a fistula to make sure that we find out what's causing it. And you can't really prevent it except for making sure that if it's from diverticulitis, is trying to make sure you have good bowel habits, you're having not constipated, you're not straining, and you're having good, easy bowel movements. In fact, I have a bowel recipe in one of my videos, which again, I will link below so that you can review something that maybe you want to try if it's natural to help prevent constipation. Okay. Next question, can a weak immune system trigger a UTI? So yeah, people who have weak immune systems are more likely to get urinary tract infections. It's not that it's triggering the UTI, but it's because your body doesn't have the own mechanism to fight off the infection. So a lot of the time, if you look at all comers and women specifically, if you see about 40%, 40 to 46% of women can clear UTIs on their own with their own natural bodies. So just drink a lot of fluids and that pain will go away. And so that's great. But in someone who has a weakened immune system, you don't have that ability. Do you recommend D-mannose for UTIs? Can you explain what it does? So D-mannose for UTIs is something that is currently under investigation as a preventative measure for UTIs. Off the top of my head, I can't remember the mechanism of action, so I don't want to give you the wrong information, but it is currently under investigation. The studies are not conclusive as to whether this helps with UTIs or not. I have heard from some people that they've had benefit, but I don't recommend it for my patients because I just don't know. And I don't want people throwing money at things that we don't know if they help or not yet. How can I swim in a pool without getting a UTI? I usually get one after swimming. Well, there's no good data on swimming and associated with UTIs, but what I would recommend is making sure, and there's, again, no data to any of these recommendations, but make sure you don't sit in that bathing suit for too long. Make sure you take it off right after you're done swimming, and that can help. But if you're noticing that it always happens after swimming, you may want to talk to your urologist about starting what's called a prophylactic dose of antibiotics, like one dose after you go swimming to help prevent the UTI. But again, make sure you meet up with a urologist to discuss this further, or even your primary care doctor if you don't have a urologist nearby. Do Kegels really work? At what age should I start? Well, Kegels, so they're used typically for strengthening the pelvic floor. We'll use them for women who have stress urinary incontinence. So there's no good data on prevention. In fact, if you do too many Kegels and you don't do them correctly, you can actually create a pelvic floor that's too high tone, which means it doesn't relax when it should, and that can create other problems. So if you're having stress urinary incontinence, it's a great idea to start Kegels. And again, stress incontinence is leakage that occurs when you are when you're having pressure on the bladder. So coughing, sneezing, exercise, those sorts of things. And Kegels can help. I have a whole recommendation on my video on Kegels, so I'll put that down below on how to do them, and what to do. And there's great videos on here from a lot of physical therapists on YouTube who talk about doing Kegel exercises, but I don't recommend doing them if you don't need to, if you don't have an indication for them, to do them. Okay, is having a low white blood cell count dangerous? Do you think antibiotics can cause this? So a low white blood cell count is something that we see on a blood test called a CBC, a complete blood count. And is it dangerous? Well, it can be. And so you really need to talk to your primary care doctor to evaluate this. And can having antibiotics cause a low white count? No, usually it's something that is innate in your immune system that's causing the white blood cell count to go down. All right, give me 1 second. I'm just going to take a little sip here. I hope you guys are enjoying this. Again, just a reminder, this is a special live that's sponsored by Elora. Thank you guys so much for sponsoring me. I use Elora for all of my patients with recurrent bladder infections. It is the only supplement that I'm aware of on the market that has 36 milligrams of soluble proanthocyanidins, which actually help UTIs, people who are suffering from recurrent UTIs. I have so many patients who come to me every day and say that they love it and they're so glad I introduced them to it. So check out my video from Monday on this topic if you missed it. Okay, I have a lot of kidney stones, 12 now. That's a lot. I'm sorry you're going through that. And stones come out easily after a little pain for a day. Will that affect my urinary tract? Well, so the reason that we worry about kidney stones, one is because they cause pain, right? And so when you pass a kidney stone, if yours are tiny, you may not have a lot of pain, but some people have a ton of pain. If they're a little bit bigger, they can cause a lot of discomfort. And I've seen people say it's as bad as childbirth. I mean, I will see people in the ER like writhing on stretchers when I go evaluate them for kidney stones. So that's one of the reasons that we do it. Another reason is that if the kidney stone is big enough that it blocks the urinary tract, if they're tiny, they probably won't. But if they block the urinary tract, what can happen is you can like reduce urine flow from that kidney, which over time, say you're not having pain and you don't realize it, that can cause that kidney to function less optimally and slowly lose kidney function on that one kidney. So that's one reason. Another reason is if it blocks, just like I talked about, and you get a bladder infection or not a bladder infection, but an infection in the urine that's coming from the kidney or from the stone itself, and it's blocked, you can get very, very sick. In fact, I've had young, healthy patients who have no medical problems get super sick and in the ICU because they have a stone that or the intensive care unit because they have a stone that's blocking their urine and they have an infection. So those are really the reasons to treat a kidney stone. If you have a lot of kidney stones like that, please see a urologist to talk about how you can prevent kidney stones. One of my very early videos, I think it's Reacting to Friends, I talk about some of this prevention for kidney stones. So I'll link that down below as well after this is all done. Okay, why does recurrent UTIs occurs? Antibiotics are helping. It is immune system as my ultrasound is normal. That's a great question. You know, I wish I knew exactly what causes recurrent UTIs because then we could target that as doctors. But sometimes, like I said, we know that in women who are postmenopausal, lack of estrogen is a risk factor. We know using certain things like spermicides are risk factors. We know dehydration is a risk factor. We know there are things that put you at risk for getting UTIs. Family history of having recurrent UTIs can also be a risk factor, but we don't know exactly what causes them. And so it's really a matter of trying to get ahead of them and trying to really prevent them from happening again, and having a discussion with your urologist or an infectious disease doctor or even your primary care doctor to talk about like, hey, this is really affecting my quality of life and I just cannot move forward and get over this. It's really a problem. And so that they can come up with some strategies to help you. And I will tell you, there are some patients where I try every little, trick in the book and they still get UTIs, and I'll have them see an infectious disease doctor and we still can't get them clear. So we do our best. We try our best with what knowledge we have. There's tons of studies going on for recurrent UTIs right now. And even I'm doing a study where we're looking on social media and Reddit to see how this is affecting people's quality of life and really get a comprehensive picture of this impact on people's life, because I think that a lot of times we know it bothers people, but like how much and how horrible is it doesn't come across to the general population. Is low trace of ketones bad in the urine? I know high means diabetes. So I'm not, low trace, I don't get too worried about, particularly if you haven't eaten that morning and you give a urine sample, or if you're on a like a diet, a ketone diet, or keto diet or ketogenic diet, that can happen. So it's not bad if you are feeling okay, but you do want to get evaluated if it consistently comes back with ketones and you're eating normally and you're not trying a special diet, to evaluate maybe if there's something else going on. Can semen retention cause UTI? Not to my knowledge. I don't think that semen retention can cause UTIs. I do see that some people who retain semen for whatever personal reasons, no FAP, they're trying something, they can get kind of pelvic pain, or, this like sensation of like just pain in their testicles and things like that. And then they can feel like, oh, maybe that's a UTI. But really for those people, because they've been, retaining or holding off from ejaculating for so long, it's actually because their pelvic floor gets very, very tense and stressed out from the semen retention. If that's you, I would recommend not doing semen retention for that purpose alone, because that's going to create more problems. Is long-term consumption of D-mannose or cranberry pills safe? So D-mannose, oh, sorry guys, I just lost one of my lights, but is D-mannose, I don't know the long-term data on D-mannose. And so I can't speak to that, but for cranberry pills, it's extremely safe. It's literally from the cranberry, the fruit of the cranberry itself. And it's from the actual, the fleshy part of the cranberry, not the skins and the seeds and the stems. So it's really safe to have and take for the rest of your life. There's very little side effects. The only thing I've seen is if someone has something like interstitial cystitis or IC, that can sometimes be flared up with cranberry. And so those are the only patients I find that just get like symptoms of urgency or frequency when they take the cranberry pills. It's extremely rare. Most people can tolerate it just fine, or if you have an allergy to cranberry. Do I think probiotics help? So maybe. The answer is maybe. I think that probiotics potentially could help, but in general, there's so many different kinds of probiotics on the market, and I don't know the concentration, the optimal concentration of probiotics, and what blend of probiotics you need to help with UTIs. So I don't recommend them because I just don't know. Is there one that's been studied that actually works for UTIs? Not yet that we're aware of. What do you recommend to help with sex drive after menopause? That is a wonderful question. I'm going to just plug something here. I am doing a summit called the South Asian Wellness and Health Summit, and everyone's welcome. You don't have to be South Asian. And we have 10 panel discussions with physicians like me. I'm doing one on men's health on August 7th. It's going to be live and it's going to be on Facebook. And so if you guys want to, I actually have some experts coming on who talk about menopause and pain and things like that. We're going to be talking about this exact problem. And so you can go to the website, southasianwellness.org. It is free to sign up and register before August 2nd. And so you can get a great answer to that there. And I will be doing a full 1 hour or 45-minute panel with myself and 3 other urologists to talk about men's health, testosterone, erectile dysfunction, and all and prostate cancer and things like that. So please, if you are interested in learning more about those, register, and then we'll give you a link to the Facebook group, and would love to see you there. But as far as other things right now to help with the sexual drive that I can tell you, one, if you're having dryness vaginally, estrogen of any kind that goes vaginally can help with that dryness to make it more comfortable. There is other things like just, it's normal at times to have a fluctuating sex drive. And so things that I've recommended, I did a video with Dr. Kelly Casperson. We talked about kind of women's pleasure, but some of the things that we took from there is, scheduling time for sex. So you have kind of time to get excited about it. Like when we were young, we used to like schedule a date with our significant other and get like really excited because we knew there would be a chance for sex. And now we just kind of expect it to be this spontaneous, amazing thing, but like we have all these other things going on, or we just may not feel up to it all the time. And so sometimes scheduling it helps. And other times is you're not going to have this spontaneous desire that you used to when you were younger. Like you're not going to see your partner and go, oh yes, I really want to sleep with them or have sex with them. So you kind of need to like just be with them, lie with them, spend time with them, touch them, be intimate, and it will come and it will grow with time. So try those things and attend our summit if you can. How to get rid of yeast infections of an uncircumcised guy besides circumcision? How is it different from a yeast infection in women? Great question. So an uncircumcised man can get a yeast infection if they're getting urine that gets trapped in that skin over and over again. And then that's creating a wet environment where yeast can thrive. And so a way to help prevent that is make sure that when you urinate, you pull back the foreskin, you urinate, you make sure you're completely done, like jiggle a little bit. And then you can even use a little bit of toilet paper to just dab it dry and then put the foreskin, back, and just make sure that you're having, when you do get the yeast infection, that you treat it pretty promptly with a cream that can help, you can get from your primary care doctor, so that it doesn't, just get worse and worse with the dampness from the urine. Any food do's or don'ts if you get a lot of UTIs? So I think the one thing is you want to think about things that might cause symptoms of a UTI, and they may not actually be a UTI. So there are things that are called bladder irritants. And I tell people like, Some people are irritated by some of them and some are not. So the best thing to do is try to see what's in your diet, take one thing out at a time, see if it makes you feel better. And if not, put it back in. So I have a whole video on bladder irritants, and the common ones are alcohol and caffeine, as I mentioned. And then for some people, it's spicy foods, acidic foods, citrus juices, artificial sweeteners, tomato-based products. And so these aren't going to prevent UTIs, but they're going to prevent worse symptoms like urgency and frequency in some people. So you can try and eliminate some of those. Okay. Hi, Dr. Rena. Most of the time when I have sex with my partner, I face an itching problem and UTI. Can you help and give a solution of how to get cure or treatment? I'm very thankful. Well, I'm thankful for you for being here because I love doing this. I love giving you guys evidence-based medicine and preventing misinformation. That is my whole reason that I'm on YouTube, because I just really want to get good education out to you all. And I've learned so much from all of you guys. So thank you so much. And thank you guys, especially in other countries. I realize, the US doesn't have a great education for sexual education, but in other countries, it's virtually zero. And so it's been really a pleasure to educate you and be a part of your learning experience. So thank you. So essentially on your question, if you're getting infections after sex, one is make sure you're getting actual infections. Itching is typically not a symptom of a UTI. It's a symptom maybe of a yeast infection, or you could have another vaginal infection like a bacterial vaginosis. So make sure that you are truly getting a UTI. Get a urine culture from your doctor and make sure that there's actually bacteria growing, and see a gynecologist and make sure there's nothing else going on in the vagina that might be causing these symptoms. But if you are truly getting infections only after sex, one is there's no data to recommend this, but it's extremely, low risk, is just go pee right after sex. And two, you can do things that can help prevent the UTI right after sex. And one of them is to take a single dose of antibiotics right after sex. Or two, this hasn't been fully studied, but I do recommend it for people who don't want to take antibiotics, and that's maybe trying to take 2 cranberry tablets the day of intercourse and 2 the day after. And so that can help as well. Do you treat female patients? Absolutely. In fact, more than half of my practice is female patients. I am fellowship trained in female pelvic medicine and reconstructive surgery. And so I do a lot of urinary incontinence, a lot of prolapse, a lot of overactive bladder. And for men, I do a lot of BPH or enlarged prostate, all the same urinary symptoms. I do sexual dysfunction, low testosterone, and a lot of things like that, as well as male reconstruction for people who have urethral strictures. So I do a lot of things basically on the non-cancer side of urology is where my expertise lies for both women and men. What is smegma and can it be a cause for UTI? So smegma is essentially a buildup of kind of what's like almost like dead skin cells that build up underneath, foreskin, or even in women, sometimes we can see it build up under the clitoral hood. And so it can be uncomfortable and it can cause symptoms that might feel like discomfort when urinating. And so if you find it, just make sure you clean it. So essentially retract, for men, it's easy, retract that foreskin and clean it, and then put the foreskin back. Make sure you never, when you retract your foreskin, never forget to pull it back. If you forget to pull it back, it can create what's called a paraphimosis. And what that is actually quite frightening, is you can get very swollen, and in the tip of the penis or the head of the penis, and beyond the foreskin creates like this band, and that can be a surgical emergency. You have to go to the emergency room, and we will try to manually reduce it, but sometimes that may require a procedure to reduce the foreskin. So cleaning it regularly can help. And for women, you won't really know unless you get an exam or can actually retract that clitoral hood and see underneath there. Can you tell me if there is a link between UTIs and hidradenitis suppurativa? So hidradenitis suppurativa is when you get very big kind of lymph nodes, and they can happen sometimes in the axilla, like underneath the arm, or in the groin. And no, I don't know. I don't know if there's a specific link between those two things. So thank you guys so very much. And thank you so much to Elora for sponsoring this live. I know there's lots of other questions here that you all really wanted to answer. And I will, what I'm trying to do is do a live once a month. But because I take call on weekends, sometimes it can't be the same Sunday of the month, but it will be a Sunday once a month. I will try to do a live, and I will try to, you guys can certainly send me questions by via Twitter using the hashtag live with Dr. Malik, and tag my my handle, which is Rena Malik MD, and I will answer them on my next live. Thank you guys so much for joining me. And please always remember to take care of yourself because you're worth it.